the role of chemotherapy is a little more controversial. People are still debating whether these patients just undergo surgery first, then get 6 months of adjuvant chemotherapy versus getting 3 months of chemotherapy first, surgery, followed by 3 more months of chemotherapy. And there are a couple of trials going on looking at that issue. The EORTC trial in Europe looked at getting 3 months of FOLFOX, followed by surgery, followed by 3 more months of FOLFOX versus just undergoing surgery first, and they found no overall survival difference, and that data just came out in this year's ASCO. And there's also, in the United States, there's NSABP C11 trial looking at the same issue, and that trial is still ongoing. Finally, resection of primary tumor has been controversial in metastatic colorectal cancer patients for a long time because there have been several retrospective studies looking at cancer registry, most of them showing there's improved overall survival benefit in patients who in stage 4 disease and to have their primary tumor removed. And a lot of the thought was that, well, if you have the primary colon cancer intact, a lot of them are going to develop perforation, obstruction, or continual bleeding, increasing the morbidity and mortality of those patients. However, with the newer agents, especially with the new biologics that we have now, there are now more studies coming out, and most recently in this month's JCO, there's the first prospective trial showing that these patients, if you leave the tumor, the primary colon tumor in there, and just start the chemotherapy treatment, you don't necessarily see an increased morbidity.